For literally millions of Americans, dental issues aren't just cosmetic. They affect everything from self-esteem to physical health, communication, even job performance. Traditional dentures and dental implants can take months to complete and often with complications. But a growing number of patients are finding relief through a new approach that promises permanent teeth in just 24 hours. Joining us now is Dr. Jordan Heimer, one of the highly trained professionals at Nuvia Smiles. Thank you so much for being here.
Thanks for having me.
Dr. Heimer, I appreciate it. Tell me the history of implants and why your approach is different.
Yeah, so I mean, dental implants kind of came from, it was actually an orthopedic doctor back in the 60s.
I didn't know that.
Yeah, so they were training, he was doing an experiment to look at rabbit femurs. And so they placed a cannula through the femur, and then after the months of it being in there, when they went to remove it, they realized it was stuck.
Got it.
And so, so he kind of thought, was like, well, where can I use this technology, right? So they transformed that into dental implant technology, and then they actually did the very first ever patient, and that patient lived with them for 41 years before he passed away.
When were those early cases?
This was 1965 was the very first one.
And then by the 80s and 90s, I was seeing my patients go through that. It seemed like multiple procedures and took forever and they were frustrated, right?
Yeah, so there was, and then there was a Portuguese doc that actually kind of came up with the current, procedure, the way that it's done, where you get dental implants and then they do attach a set of prosthetic teeth to them that same day, and that was in the late 90s.
And then what have you guys done different?
That method, a patient would get a set of temporary teeth. So they would get a set of teeth that were made out of acrylic or a plastic material. Our prosthetic is the final, so it's a zirconia set of teeth that very next day. That was our big innovation in it, because as you said, patients will go through temporary after temporary after temporary, and those temporaries have a tendency to break throughout a patient's, throughout the life of while they're healing, right? Our procedure is meant for patients that, you need an upper set, a lower set, or a full mouth of teeth replaced. So whether that's decay, broken teeth, periodontal disease, things like that.
I was just going to say, people are not focused on their gums the way they should be.
No.
And so periodontal disease still is alive and well.
Correct, very much so, very much alive and well, yeah. It's a disease we unfortunately don't have a cure for, we just manage it.
And you guys do a great job with cosmesis as well as functionality.
Correct.
And speed.
Correct, yeah, functionality, we're a function first clinic, but with teeth, the best thing is that when the function happens, the cosmetics happen along with it.
I have seen the results of some of your work because we like Nuvia so much. Our own executive producer took advantage of your services.
Exactly.
And we're going to hear that story. He is as I said, our executive producer here at Health Uncensored. He went through what he described as a nightmare before finding Nuvia and what you guys have to offer. So watch this.
Well, I went in because I had a toothache. They took a few x-rays. So I thought this was going to be a simple procedure, maybe a root canal. And then they said, no, you have an infection. It's spreading across. We suggest pulling all your upper teeth and replacing them with implants. It was a nightmare. The permanents, when they were put in, I immediately noticed they look like giant chiclets, and then they start moving around. And when I went back, that's when I was informed that the implants failed and we're going to start over. Thank God Nuvia was a guest on our television show. They're talking about teeth in 24 hours, and I'm looking at the segment outlines and I'm thinking, this is exactly the nightmare that I've been going through for the last year. And here we are, and I'm hoping that they could fix us and give me back my smile, my speech, my edge in meetings, my communication skills. I'm hoping that all of this comes back, because I never want to have to sit in that dentist chair ever again.
Here to share his success story with his new improved smile is Health Uncensored's very own executive producer, Orlando Espinosa. How are you, sir?
I'm doing terrific.
Look at those teeth, they're marvelous. So much better from where you were.
Yes.
So how was the experience?
The experience with Nuvia has been terrific.
Yeah.
I mean, as you're aware, I've been in a 2-year process with this. Failed implants, failed temporary teeth, falling out in the middle of meetings, having to rush to the dentist office, and with Nuvia, they feel great. I could do anything, eat anything. I'm still working on my speech a little bit, but other than that, it's terrific.
Is that common to get a little tongue stuff?
Very much so. We're kind of installing a new cage around that tongue, and so the tongue's got to learn to work around it a little bit, and that can take a couple months.
I don't know, Orlando's tongue has been incorrigible for a long time, so there's no telling whether or not there'll be any progress or not.
Yeah, that's funny.
It sounds like you're doing less trauma to the mouth too with whatever you guys are doing. Is that true? Because I was really surprised how well he was 2 days later.
Yeah, I mean, it really is. It's just, you know, because of the way that we do our procedure and delivering that final prosthetic, the materials are, you know, they're more hygienic as well. You know, so you're not dealing with something that's going to kind of collect bacteria around it over 4 months, and that can kind of contribute as to why.
They feel great. They feel natural.
Yeah.
It
They
feels
look
like my
beautiful.
teeth in my mouth.
Yeah.
So.
They're just spectacular. I mean, I'm kind of jealous. You didn't do the surgery though, right?
I did not. No.
Did your peers complain about the behavior of the patient?
Oh yeah, we'll keep that under wraps. You know, we won't talk about that.
They did.
Was he
Yes, they
anxious
did.
coming in? Did he cry or anything?
Lots of tears. You know,
You guys thought he
just
figured he'd cry, right? You heard that he cried, didn't you? The staff here? Yes.
I remember asking your
They
surgeon.
heard it from the studio. You know,
There you
so
go.
that's what it
Right,
was. so.
exactly. I remember asking them, am I your most difficult patient? And they're like,
They were like,
yeah,
good night,
maybe
good night,
top
count
10.
to 10.
The nice way of
Right,
saying that, yeah,
exactly.
no, you know. So.
No, but his staff was terrific. The whole staff at Nuvia. From the time you walk in, the reception desk makes you feel at home and comfortable.
Which is great.
To the doctors, to the surgeons, and you meet them all before they actually work on you. I was a very difficult case.
I
not
know
just-
that about you.
Not
There's
just
no
from a
doubt in my mind.
personality perspective, but from a patient perspective,
From the
because
mouth
I had very
perspective.
little bone. She said, you're a difficult case. In the worst case scenario, we may have to go up to your jawbone.
The cheekbone there.
Cheekbone, correct. So I was prepared for the worst. And so as soon as I came out of the anesthesia, I said, did you go into the cheekbone? She said, no, you're going to be fine.
So now here we are. We met these guys. You became a patient. What do you have to say to other people that may be dealing with God knows what with their mouth now?
It was an easy process. They look great. And
Like skip looking around, just
yeah,
go right
just
to
get
it.
it done.
So if you are ready to reclaim your smile and your confidence, be like Orlando, be confident, visit their website at nuviasmiles.com. We'll be right back.